Hello, and welcome to Tuesday's Talk. So I always have an inspiration of why I decide what my topics are. Now, some of my inspirations I hope will come for some of the people who are following me on Instagram or Facebook. And like I said, if you want a specific question answered or have some thoughts, drop us a line. We'll be happy to talk about it on one of the Tuesday Talks. So this week's Tuesday Talks, I'm going to talk about the importance of board certification. What's my inspiration? Well, recently in Atlanta, there was a medical provider who had her medical license revoked by the state board on a somewhat emergent basis. That's the second person I know of in Atlanta, and they've had very significant problems without mentioning any specifics, but I know of at least two people in Atlanta who are practicing, quote, cosmetic surgery or plastic surgery, but they're not board certified by the American Board of Plastic Surgery. So what's the importance of that certification? Well, first of all, there's a lot of board certifications, okay? So the big umbrella is the American Board of Medical Specialties. They're the ones that recognize what people consider the more traditional boards, okay? And the American Board of Plastic Surgery is part of that. There may be some other boards that include the names cosmetic surgery or whatnot in it, and they're not necessarily part of that, and their guidelines for what it takes to be a member is different. So what you want to look for if you're going to have cosmetic surgery, somebody certified by the American Board of Plastic Surgery. And what that means is they've done the requisite training, have experience doing operative cases, and have met criteria and also passed rigorous testing to come to that point, okay? And it's not an automatic once you finish training. There's a written test you have to pass first, and then there's an oral examination, and you have to compile enough of your cases that you've done on your own to present and pass that. So what that means for my situation specifically, so after my 4 years of college, I did 4 years of medical school, which is common for anybody who's a medical doctor. Okay, now once I finished medical school, I did 5 years of general surgery. So usually before you go to plastic surgery, there's some sort of prerequisite training, although they have a newer program where you still have to do some surgery, but not necessarily the entire 5 years of of general surgery. So you can do ENT, you can do urology, you can do orthopedics, you can do neurosurgery. So I did general surgery, and at one point I was actually board certified in general surgery. I don't practice that anymore, so there's no reason to keep that certification. So once I completed my general surgery, I did 2 years of plastic surgery training. Now plastic surgery training is actually 3 years. So you see, I have 7 years of training after medical school to become a plastic surgeon. And that's vastly different than somebody who becomes a medical doctor and says, well, I only need to take a weekend course so I can inject some Botox and fillers. Is that the most complicated thing I do? No. But because of all that background training I have, if you have a problem, the injection's in the wrong spot, blood supply's been compromised, I can recognize it because I've seen it before. When somebody's just taking a weekend course, you can't possibly have the depth of experience. And that's what you get when you get somebody certified by the American Board of Plastic Surgery. They've done the requisite training, have shown that they've done cases. And the other thing you got to check when you're going to get your cosmetic surgery, not only ask the surgeon, are they board certified, because they can be board certified, who are they board certified by? And probably the better question is, do you have privileges to do this operation in a hospital? Because the hospital is going to ask some very specific questions, where if you're doing it in a surgery center, particularly if you own the surgery center, you make the guidelines. And because you have a medical degree, might be the only requirement, whereas in the hospital, you have to have the requisite training and show that you've done cases in this area before they give you privileges to do so. So it's buyer beware, and just because somebody puts himself out and they advertise doesn't mean that's always the safe or best options. And oftentimes you'll see these people who are not plastic surgeons, they might even charge more than some of the surrounding plastic surgeons. So like I said, be careful, do your homework, and find somebody that you're comfortable with and has the requisite training and experience to give you the best chance of having the best result. Thank you.